Welcome back to Pharmacology with Dr. Sokolow, and this is only like a very short video with 3 updated slides that Dr. Gillis provided me with. The first one is related to the treatment of Parkinson's disease, and it is about the levodopa-carbidopa intestinal gel, and it's marketed as Duodopa. So this formulation is very interesting and very effective. It's shown to be effective in reducing levodopa-induced dyskinesia by 40%, but also it also reduced the off period that is seen with the oral formulation. So the advantage with this intestinal gel is that instead of having fluctuation in the peak of plasma concentration, the concentration in the plasma remain pretty steady because it's given by infusion. And the other advantage is that it's administered directly in the small intestine. And so in patients with Parkinson's disease that has a reduced stomach emptying, when you give the oral formulation, the medication tend to remain in the stomach and not well absorbed because it has to be absorbed in the small intestine. And so that's why you see fluctuation in the plasma level. By giving this intestinal gel formulation, you bypass the stomach and go straight where it needs to be absorbed, and so you have more stable plasma level. You see less fluctuation in the on and off effect, and then also you see less induced dyskinesia. So the disadvantage is require a minimal procedure to insert the catheter in the intestine, and also the patient needs to carry a pump that is not small. So usually patient who has later stage of Parkinson's disease will be put on this intestinal gel because of that matter. And even though it can be beneficial for earlier stage, patients who are less impaired may not want to go through this procedure and deal with the pump. So there are other clinical trials that are on the way to treat the levodopa-induced dyskinesia, such as new dopamine 3 receptor agonist, and then other intervention that can be useful for the treatment of levodopa-induced dyskinesia are the brain stimulation, usually directly in the substantia nigra, that may be more effective in the striatum. So the next slide is about the treatment of Alzheimer's disease and the recent approval of Aducanumab, branded under Aduhelm. So you probably heard that there was a lot of controversy regarding the FDA approval of Aducanumab because the result of the clinical trial were not very convincing for the scientific panel. So there was no improvement in the cognitive or the executive function with Aducanumab. What they were saying is that this antibody lowered the amyloid level in the AD brain, but this removal of the amyloid does not necessarily correlate with an improvement in the cognitive and the executive function. So this, drug was approved, but against the recommendation of the scientific panel. And there is here a link that you can click on and also put it in on CCLE, where you can see like all the firestorm and criticism about the FDA approval of this monoclonal antibody. Not only, doesn't show benefit on the cognitive and executive function, it's associated with severe adverse effects such as urticaria and angioedema. It's very expensive, and it has to be administered as an infusion over 4 weeks. So it's administered once every month as an infusion. So not optimal, and only approved to lower the amyloid beta level. So the third update, it's about ketamine. So ketamine has two different enantiomer as most of organic compounds, and it's as an enantiomer known as S-ketamine and branded under Spravato is the enantiomer that has the analgesic, anesthetic, and antidepressant activity. And so Spravato is actually FDA approved for the treatment of major depressive disorder, and it's available as a nasal spray. Now, because of the risk of abuse, even though it's more pure than the racemic version and the one that is abused, there is still risk of abuse, and this is why it's a Schedule 3. And also it's under a REMS program where the patient needs to be treated in the doctor's office. So the patient will receive the intranasal spray twice a week under the supervision of the physician to see if there is no adverse effect, mainly hallucination that can occur with S-ketamine, and also to reduce the risk of abuse and misuse, because this is a drug of abuse as seen in the module of the drug of abuse. So the FDA also issued a black box warning regarding the risk of increased risk of suicidal thought, but this is seen with all the antidepressant drug. So there are also like many other clinical trials that are still in progress for the use of ketamine for the treatment of depression. And then low dose of ketamine also under investigation for levodopa-induced dyskinesia, and recent evidence also suggests that it may be better than Haldol for extreme agitation in the ER setting. And so that was it for this quick update on those three drugs.